Native Houstonian Dr. Damien Kelly has served in social service organizations for over 15 years. He knows about working in nonprofit organizations, and he's seen firsthand what happens when communities do not have access to care. He has been a director of multiple organizations, and he now is refocusing his career to align with research initiatives. He has an unwavering belief that today's research can lead to tomorrow's cure. And as a member of the Health Research Institute at the University of Houston, he's here to talk about some of the social determinants like income, education, and access to health care, and how that influences the breast cancer outcomes in different communities. He is truly a breath of fresh air for a subject that is often misunderstood and creates barriers all of its own. When you subscribe to our show, you help us grow. Someone you know may need to hear this story, so please share with your family and friends. And consider supporting our mission. Your donation can help save the life of an uninsured woman. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. So, Damien, thank you so much for being with us today. And this is going to be a different kind of podcast, right?
I'm excited.
You're interviewing me, but I hope to be able to interview you.
Okay.
And I know you said we don't have to, but actually you're Dr. Kelly. And tell us a little bit about your background and what brought you here.
Oh, boy. No problem. Yeah. So thank you so much I get to be on The Rose. I've actually been listening to some of your guys' episodes. I love your interview style. It's not supposed to interview, it's more of a conversation. And I really appreciate that when you guys are doing your thing.
Thank you.
Rose, The Rose here is fantastic. Dorothy, I love the studio. The staff is great. So I'm doing my little plugs, what I tell people who are behind the scenes doing all this. They do such great work. So what brought me here? Oh my goodness, that's maybe a long story. So
well, shorten it up a little bit.
I gotcha. So I did about 20 years in social services, working at the Houston Housing Authority, Catholic Charities. I still run a homeless drop-in center on Sundays called Open Gate, which for homeless youth predominantly. I've done that for about 7+ years. I got my doctorate in May of 2022 and decided to switch to social science. So I applied for some jobs, and the University of Houston at the time, Dr. Obasi was our PI, and he said, hey, I want to give you a shot. We had a great interview. We really just talked about his research. And we had a 30-minute conversation about research. And he said, I'll call you in a couple of weeks, and I want to make my decision and whatnot. I got a call like 2 days later. Hey, we want you on board. So I've been here ever since. It's been a blessing to just be with the people at U of H, the Health RCMI. They do such great work. It's a research center for minority institutes, and U of H is an HSI, Hispanic Service Institute. There are a few of those here in Texas. And what's great about the work we do, we really it's community-based science. So we really get to engage with communities and things that they're actively participating in and things they care about. And you really get to, once you disseminate some of these projects, once they're done, you really get to see how they make impacts pretty fast. Mm-hmm. So I've always kind of had that idea that if I was blessed enough to get into science, I don't want to do the science that just sits on a shelf somewhere and it's kind of filed away and it was done. Right. And I want stuff that's actually going to be able to be put in people's hands and people can oh wow, I never thought about it this way, or I've never looked at this before.
Yeah, but what a background you bring if you've been down there in the trenches.
I stay in the trenches.
That's where the fun's at. But really, there's a difference in knowing and in experiencing, no matter what. So, and I know I'm on the Community Advisory Board, which blessed to be on it. Never sure why, because there's so many brilliant people involved in the health program in their institute.
Yes, ma'am.
And it's beyond just smart. They are really thoughtful in how they provide the startup grants and how the whole thing is working. I've been incredibly impressed to be a part of any small part of that program.
Yes, ma'am. We're blessed to have you.
Oh, thank you. So how what brought you here today?
So,
what are we talking about?
One of the things I do at U of H, I have a podcast called Speak Your Piece. And we interview tons of people, really who are local people making those impacts. I love talking to people who are boots on the ground and who are engaging with different people in different aspects of life. I've always kind of had that thought in my head that, if you're in a pulpit and you're preaching to an audience or you're preaching to the congregation, the people in the congregation navigate through life differently than you do, than that preacher does. They see things at a different level. I want to talk to the people who are kind of at that level, who may be kind of in the pulpit, but they spend a lot of time down in the trenches, doing the work, getting things done. And I want to see things from their perspective. So I was like, we're re-upping our podcast again. It's been since Dr. Obasi did leave the university. He's gone on, I believe, Wayne State, so he's great. We have some new people in charge. Dr. Beats is fantastic. So we bring back our podcast. We're like, well, who can we start talking to? That way we can start disseminating this information. And like the Rose came up in conversation. I was like, well, yeah, I've seen you. So now most of the world now, we are all telecommuting. We're all working virtually. So I've seen your square in your face on like a Teams or a Zoom meeting, but I've never got to meet you in person. And I'm like, okay, this is a great chance to shake hands and, hey, how are you? I love listening to you when you're in these meetings. I want to know how you got here today. What is so special about what you guys do here at the Rose? I know from kind of like a back end, but I want to see how our participants can kind of engage you guys as well.
Okay. So the Rose is basically here because we don't want any woman or man to die from breast cancer because they cannot afford the cost of a mammogram. Basic. That's it. We serve 40,000 people a year. We do mammograms and ultrasounds and diagnostic workups and biopsies and physician consults. But the most important thing we do is to get that uninsured woman who has been diagnosed with breast cancer into treatment. Now, there's lots of programs out there you can get a mammogram. A lot of them, they're going to tell you, oh, you got a problem here. Very few, especially if you don't have money, don't have insurance, they're going to get you into treatment. And that is what we're all about. It's access to care has been it from the beginning.
Yes, ma'am.
We're 38 years old. And in the beginning, my life was not going to be in nonprofits, guarantee you.
Okay.
And but Dr. Dixie Malillo, general surgeon, doing breast surgeries, as well as all kind of other surgeries, was seeing a lot of late-stage breast cancer. My job was to get her out in the community and talk about the importance of mammography, the importance of having a mammogram, and the hospital we were both at had a dedicated breast center. So for me, I'm a marketing person. Okay. For me to get to sit and listen to her talk to groups and to hear the questions the women ask, you couldn't get that kind of education anywhere else. It was such a new modality, had a lot of pushback. Most doctors were not going to recommend it. It wasn't covered by insurance. So, if you had a problem, it might have been covered, but not screening.
Okay.
And then we met a wonderful woman named Rose Kushner, who told us to get off our butts and go start a nonprofit and stop talking about it.
Okay.
And so Dixie's married name at the time was Rose. My maiden name was Rose. We'd met Rose Kushner. That's how this place got called the Rose.
Nice.
We decided we needed to do something for her. And anyone that wants to look up her background, she was a journalist for the Baltimore Sun.
Okay.
And
I thought you guys were out of D.C. or you were out of D.C., correct?
No.
Well, you don't sound like you're from the
Her.
South. Okay.
It was just her. We started something in D.C. We were a mentor for a group that got started in D.C. But when Rose found the lump in her breast, her doctor told her he was just going to go in and do her surgery. If it was breast cancer, he'd do her mastectomy. He'd come out and ask her husband if it was okay. Rose said, huh? This woman was the first female journalist to cover Vietnam. She stood about 5 feet tall. She had a mouth on her that No one could be easy around. And she was
Okay.
going to tell you how it was. And she said, there is no way you are going to take my breast off without me making that decision. Damien, it
Yes,
took
ma'am.
her 16 doctors, 16, before she found someone who would let her wake up and make that decision. Now, this is 79.
Yes, ma'am.
Standard of care back then.
I got you.
But
Different
it's
times.
because Rose Kushner went to, she said, you will never change anything if you don't change policy.
Yes, ma'am.
She said, you can talk all day long, you can educate all day long, but until you change those policies, then it won't make any difference. And sure enough, she did. She got Medicare to cover screening. She got the 2-stage procedure put in place. I mean, I can go down the list, but she, for me, she was my hero. She was, you know, I was so, it's not even, blessed it's not even the world. To get to meet someone that you know about, you've read her book,
Yeah.
and you're sitting at the same table with her.
Oh, yeah. You have the whole
mean,
fangirl experience on
Oh,
stage.
my gosh, yeah. There was nothing I wouldn't have done for her, but you have to know, she called me every Friday and said, well, have you started your nonprofit? I'm working a full-time job there. You know, I'm not going to start any nonprofit. And then she'd call me the next week. Well, what senator have you called about this bill? I don't know any senators. You know, it was like, it went on for months. So, but think about that. Who have you ever done that for? Who have I ever done that for?
Yeah.
You know, I think we all need a Rose in our life, or we need to be a Rose
Yes, ma'am.
to someone else.
Is that, I guess, like a mentor or that motivator that kind of sees the potential that you don't see in yourself?
Right, right. And I've always objected to the word mentor.
Okay.
I do not know why. It just always felt kind of formal or kind of whatever. But to have someone care that much,
Yes, ma'am.
and not about us, but about what we could do,
Yes, ma'am.
that's a whole different kind of caring. You know, and then to stay on you for it.
I love that.
Yeah.
Okay, so I don't have any. Oh, I do have some. There we go. Because your eyes were watering up a little bit. I'm happy. I'm like, she's going to smear the makeup.
Thank you.
No.
No, I'm not. No, I'm not. But I mean,
Well, I'm going to smear my
really,
makeup then. There we go. That's
you
what's
have
gonna
to, you know, it was a different time.
Yes, ma'am.
This was in the mid-'80s.
Okay.
This was during the oil bust. This
Okay.
was when more foreclosures were happening than any other time in Texas.
Yes, ma'am.
People were out of work. They
Yeah.
didn't have insurance. Women were coming to us with cancers that had outgrown outside their breast. And we're sitting there like 2 pounds of hamburger. And it was my job, because I was a medical photographer, to take those pictures. Believe me, that's not a picture you ever want to even
Yes, ma'am.
see, much less smell.
Oh, yeah.
Cancer has its own way of making itself known. It doesn't just go away.
Yes, ma'am. So flash forward to 2024. Where are we now? I know women hopefully don't have to
Nothing
see
has
16
changed
doctors like
in
that.
so many ways.
Okay. Elaborate.
They're still uninsured, more than we can take care of, who do not have access to care. And we're still dealing with the same, not same treatments, better detection, better treatment, but we're still dealing with breast cancer. I mean, there was a time in the 90s when they talked of cure. Think about it. 38 years later, we still don't have that cure. The best thing we can do is get that mammogram, catch it early, and have the right treatment, have access to treatment.
Wow. Yeah. I guess it's kind of daunting when when you hear a race for the cure, or we're going to try to cure this, or we haven't cured a lot of things. We've made some strides. We've made some detections, like you're saying, and we have some great strides when it comes to technology, but I still know so many women who've kind of gone through the scare of breast cancer and those mammograms, and oh my goodness, I've heard some interesting stories and trying to go through and like, well, what do I do? Who can I go? And it's that kind of, who is in my life that I can turn to, where someone's going to, I guess, shepherd me through this process, because it is a process.
It is a process.
It's endless appointments. It's talk conversations with insurance companies and seeing if this is covered, that is covered. Please, you know more about this than I do, so please elaborate. What's going on with insurance companies? How come we're not, or let me ask that question better. What do we need to do to get insurance companies on board with what's happening?
Well, I think for the most part, for all the face value, all the right words that are being said, the insurance companies are pretty much on board.
Okay.
What we need is to have comprehensive health care for everyone.
Gotcha.
Nothing has changed, especially in the state of Texas, when it comes to care for the uninsured, for the low income. And for women, it is the worst. Good for children, women, no. Okay. So that's an area we could really use a lot of change. Now, I have all my own opinions about insurance.
Okay.
And what the heck is this prior authorization all about? What the heck do I have to prove that my doctor who went to school, for 16 years doesn't know what he or she just ordered? I mean, and that could get me going.
Yes, ma'am.
And the other part of it is there are a system of automatic denials because you might not go back and challenge. You, the patient who's paying for this, might not go back and challenge. You, the company who filed for it and know it's a legitimate cost and a legitimate charge, might miss that 30-day window of appeals.
Yeah.
It's a system.
Yes, ma'am.
I don't want to call it racket, but it's a system.
It seems that as we've automated certain things, as we've included more technology, a lot more checks and balances have come with that also. Meaning there's a lot more steps involved in trying to get to the process, to get to the care that you really need. The doctors know you need it, you know you need it, but you have to go through a lot of issues just to try to get things what's going on. I wonder if there's, I'm sure I'm not the first person to think of streamlining some things, but the podcast you did previously, there was something you guys mentioned. You said putting yourself on that to-do list. And that really stood out to me. I think that was with Brooke Bra.
Yeah.
Is that right?
Yeah.
Bra. Okay.
Bra, yeah.
It was a lovely podcast. I was listening
Thank
to her.
you.
And I was like, well, with all the things that are kind of maybe stumbling blocks to getting what you need, how do you put yourself on that checklist? How do you develop that system where, like, okay, if there's an appeal process, who do I go to? Is there someone I can talk to who's maybe like an advocate that I can go through and kind of go through these things, and they can help me be on that, that to-do list?
Every insurance company has what they call navigators, or people that are supposed to help you.
Oh, wow.
I think the thing you've got to find is within that provider, someone who's going to also be your champion. Now, this is a different scenario altogether, Damien. But at the end of the Rose's work, when we take that uninsured woman, she is being shepherded, that's a good word, by a patient navigator. Because first of all, a lot of our women, English is not their first language.
Gotcha.
Trying to go down to any medical center or healthcare system can be daunting.
Yeah.
And so our ladies who are street savvy, speak the language, understand, have done this for years, understand what the next step is going to be and why, are right there with them. Sometimes going with them to that first appointment to make sure that doctor is understanding that they've got to talk in a different way.
Yes, ma'am.
And then some of the things that we have to do in treatment, it's really important, the timing. And so if our navigators call the patient and she says, I can't this week, I can't get off work, then it's our navigators who just say, let me talk with your employer. This is timing. It will be more effective if you get it this week.
Gotcha.
So would you know that? No. Yeah. I don't care if you're insured or educated. You don't know all these things.
Yes, ma'am.
So I wish we had a patient navigator for everyone, no matter what your problem was, to walk with you and get you through it. If you haven't been there, you won't know. And there's 17 different kind of breast cancers. That means all the different kind of treatments. There's no one journey that's the same as the next one. So you've got to know all those things. What if that woman can't pay her rent that week? I mean, that's where the navigators, again, low income, uninsured, but that's where they step in to go, look, there's a service over here we might be able to apply for. There's just too many barriers, but they're more than barriers. They're like walls. They're like roadblocks that women can't get around.
Yeah.
And then they have to deal with the family dynamics. Then they have to deal with caregivers who wish they could fix things and feel helpless. And now the woman is not wanting to talk. Go through the whole scenario. Back to your question. Insured women have the same issues many times. You tell me I've got to come back for a diagnostic. I'm 35 years old. My insurance ain't going to cover it. It's going to come out of my deductible. It could be $1,000. I don't have $1,000.
Yeah.
Go down the list. She's going to have all the same types of barriers that are going to stop her and say, do I really have to have this? What if it's nothing? It's probably nothing. My doctor said it's probably nothing. Where do we find that good information? And we all know it isn't Dr. Google.
Yeah.
We know we've got to find some places we can trust. For a woman to find that time, and I hate to always say for a woman, because I know plenty of men that don't want to go to the doctor.
Yes, you look right at me like, yes, I don't like, Dr. Heidi, I love you to death. She's my doctor. She's fantastic. But no, I do not look forward to going to the doctor.
And if you, a male, found a lump in your breast, cancer would not be your first thought.
I don't know oh my goodness, I don't know what I would think. Okay. Yeah.
I got bruised. I got hurt. Yeah. Oh, it must have been when I picked up that bulk, that whole bag of mulch there. I hurt myself.
Yard work. That's what I go to. That's my go-to.
And unless that man, unless he had some other issue that we'll discover it, or mentions it to his wife or mother, he'll never get to a mammogram. And you will be surprised how many times it is cancer.
Yes, ma'am.
So, we never want to discount that men get cancer too, breast cancer, and it can be lethal. It affects so much more than in women because it's there already. We're not screening men. We're not going to find it little bitty. But for women, think about the women in your life. Who do they take care of first? Their family. I guarantee you that kid is not going to not get to the doctor, not get to their shots, We're going to make sure that happens. But for me, the woman, going to make sure my husband knows when he needs to go. Going to make sure my brother knows.
Yes, ma'am.
But that's why that putting yourself on the list. And, I'd love it to be the first thing on that list. But it's hard to even get on the list with so many other commitments.
When you were talking earlier about, kind of the wall and what people kind of go through and those stumbling blocks, I've noticed, especially in social services, at some point, your energy to keep running through these walls slows down. You're like, there's another thing. I got to do this now also. And I thought we just did that. And what does a success story look like to the Rose? Like, I know you have many. When you're helping people, these navigators kind of go through these things and say, you know what, we're gonna go over this wall, and I'm going to lift you up. You're going to put your foot on my hand, and I'm going to help you get over the wall. We're going over the wall together instead of trying to go through it by yourself.
There's so many. I think Courtney, 36 years old, 23 weeks pregnant, found her cancer. She had to have chemo during those last months of her pregnancy.
Yes, ma'am.
Lots and lots of issues, uninsured, got her through that. There was one issue after another because, see, the program we get them on is the breast and cervical cancer program. Fabulous program.
Gotcha.
It's a Medicaid product. Not fabulous. Every 6 months she's in there having to reapply. She's in the middle of getting her drains out. And they said, oh, by the way, your insurance is not valid anymore. She calls our navigator calls the state.
Yeah.
Well, there was one thing she'd forgot to sign, or they didn't have it.
Yeah.
She said she had turned it in. She received it the day after burial. And guess when it was due? The day of burial. Didn't get to her in time. They got it cleared up so that she did not have to leave that office and come back. But imagine.
Yes, ma'am.
That's Courtney now. Both kids, she had another child, a little one, when she was pregnant. Had the baby live, well, running all over the place.
Nice.
And now she's back at doing what she did all her life, teaching school.
Okay.
Success story?
Yes, ma'am.
Absolutely. But more than that, because now, here's her words. I learned to speak up for myself. I learned to challenge things. I knew if I didn't know, I could go back to the Rose and ask, but I learned how to speak up. And I thought, that's the story.
Yeah.
You know, I'm glad she's alive. I'm delighted
Yes,
all
ma'am.
of this has come out well for her. But she can speak up. And she spoke up on a very sensitive subject in that her first doctor, who was not her color, did not look like her, sound like her,
Okay.
just kind of blew her off. You're nursing. That's not anything. What do you mean? You can't have breast cancer. You're too young. All the things that black women most often hear, which is never too young to have breast cancer. Our youngest was 18.
You hear these stories all the time of young people having some form of cancer, and it's just, oh my goodness. That is, I'm a parent. My daughter's 11 years old. How do you shepherd the parents through that process when they have such a young person who's 18, 19, 20, going through this, not even old enough to buy us a beer yet, through these life changes? How do you work with the parents and those loved ones who are like, I want to be here to help. I honestly don't know how.
You know, I think, remember, my folks are not counselors.
Yes, ma'am.
They're not licensed for any of that. We have folks that we can turn to if we need that. I think what our people do is to give them that place to talk it out. And honestly, more often, we are trying to work with the children than parents or even spouses.
Gotcha.
And I remember one story the navigators told me about. They had the two children in, the mother is there, and they're saying, now, when you have your chemo, you know, your hair most likely will fall out. The kids are looking, and our navigator said to him, but that means it's working. And so she gets a call several months later. Oh, Miss Elizabeth, it's working. Mama's hair fell out today. Well, you know, is that technically true? But is it what got them through that time? Absolutely.
Yeah. It's what they needed to hear.
That's what they needed to hear.
You have such great stories with the people you're working with here. What's interesting is by the time this comes out, maybe the election is already come and gone. It's an election year. Don't care who you're voting for. Whoever
Vote
wins.
for humanity.
Yes.
Vote
That's
for humanity.
How do you see that playing out when it comes to breast cancer awareness, your organization, no matter who wins?
You know,
what do you see on the horizon?
it doesn't matter who's in office. Breast cancer is going to be here.
Yes.
We have great bills in front of the House and the Senate right now, in front of Congress. So let's get them through.
Yes.
They have to do with eliminating what I just shared with you about Courtney having to sign something every 6 months. It has to do with trying to expand the CARES program, which has been around since 1991.
Okay.
And the only way we're going to expand it is if states will contribute more money towards it.
Okay.
Remember, it's a Medicaid product.
Gotcha.
The word we can't say here in Texas. So that's how it will expand. I mean, it has some other components. It added some other different things about the breast cancer procedures that are needed. All good, all good. It needs to cover more people. That's it in a nutshell.
Oh, wow. So what are the stumbling blocks right now for that? Is it tax purposes? Is that what's holding things up? People don't want to pay the extra money? Or
You know, it's a budgeting process.
it seems like everything is.
Who covers the budget? Who decides what goes into our state budget? Tell me, how much more rainy day funds do we need
Gotcha.
when we have people dying every day because they can't access care?
Yeah. So when you run for office,
I'm never running for office.
You got my vote.
Hey, never going to run for office.
Well, never say never. Yeah,
Too old, too wise, and much too successful to care about that.
Those last two, I agree with. Too wise and too successful. I completely understand that also. With what you guys do here now, we've gotten a lot of focus right now at the university when it comes to AI, artificial intelligence, automating systems. How has AI impacted some of the things that you guys are doing here at the Rose?
You know, our radiologists are excited about what it could do. Our producer of this podcast is always pushing me to do that, to use AI more than my own language or my own wording.
What would that look like for you?
He might bring that around to me someday, but
is it Freddie? Is
yeah, it's Freddie. He's always trying to push us a little further. I think AI it's already here.
Yes,
we
ma'am.
better learn to embrace it, or we won't stay up. But I also think we need to be careful that we're using our own brains, that we can still put a sentence together, that we don't always need help, and that we, as your podcast says, we learn how to speak our piece. We know what we know what we feel and what we need to say.
Yes, ma'am. No. I'm excited, definitely, for the future, what holds when it comes to AI. I'm looking forward to all the cool collaborations we can do with the Rose. I know there's so much more work to be done. You guys are looking at talking about your peer navigators. Some of the people, have they experienced breast cancer as well, and that's what makes them kind of know the process so well?
No,
or?
I don't think it's that. I mean, I have breast cancer patients that are in my staff. I think it's more that we all know what it was like to be down and out at least once in our life. And if you've never been there, then lucky you. But most of us know what it's like.
Yeah.
So I think that's what motivates them. I think when they see the women come back who are healthy and moving on, all of those things. So as we close, what final burning question do you have?
Oh my God! So I put my laptop down because I'm like, okay, we're actually have more of a conversation now. But I can actually go through a couple things actually. But we've actually talked about the medical coverage thing. That's one of the things I was so very curious about. Is I'm gonna move this a little closer. Why is it so hard for people to get that adequate coverage, to get what they're looking for? It seems, again, as we have integrated so much technology, the process should be easier.
It's about money. If you don't have the money, you're not going to have insurance. If you don't have insurance, you're not going to have access to care.
Yeah, it's sad that we're still in that realm to where you have people now who are like, okay, I can either pay for my medication, pay for whatever service I need, my mammogram, etc., or I can pay for my food in the fridge. I can't do both. It's sad that in our first world country, I still believe the greatest country on earth, we still have people making these decisions that, do I pay for my mortgage? Do I pay my rent? Do I keep the lights on? Or do I get my life-saving medicine?
Damien, I don't think there's a single answer for that. But here's the difference between 38 years ago and today. We're talking. That's going to be what makes a difference.
Yes, ma'am. A lot of the stuff we talked about still always goes back to that coverage question. And it's one of those burning things that, hey, I have a job. I'm working. Why isn't this covered? Or why do I have to go through this? I'm paying my taxes.
Why did Obamacare fail? Because when businesses were required to cover, they couldn't make it. It's all a matter of money.
Yeah.
I think we're going to have another podcast, Damien. I think that we have barely covered this subject.
We haven't talked about my Cowboys yet. We haven't talked about your sports teams. There's so much more territory we have to uncover with this.
That is not what we talk about here. Let's talk about your breast.
Okay, fair
But
enough.
I do think we've covered a lot.
Yes, ma'am.
Thank you so much for being with us and for being our guest today, and for having me as a guest on yours. Boy,
God bless you.
That's an honor.
Dude, you know what? It's an honor speaking with you. I love the work you guys are doing here at the Rose. It's fantastic. You guys are doing life-saving services, and anything we can do to get the word out about the stuff you guys are doing, it's an honor just to be a part of that process.
Oh, we appreciate it. We need all the help we can get.
Yes, ma'am.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.